This is the week 5 assignment about the structure and function of the eye. The eyelid, I'm going to start with the sclera. Sclera is the outer covering of the eyeball. It's a tough white layer. The iris is the colored circle area around the pupil that controls the amount of light that enters the eye. The iris opens or shrinks the pupil to let enough light in for the environment. The pupil, right here, is the black dot in the middle of the eye that light travels through. We're going to come down to here. We have the ciliary muscle, and this is what the lens uses to change shape and to focus the light. The sorry. The cornea is the clear curved layer in front of the iris and pupil. This is where light enters the eye. The cornea is a protective cover for the front of the eye and helps focus the light on the retina at the back of the eye. We already went over the iris. The lens. The lens sits behind the iris and is where light gets focused onto the retina. The focus happens when the lens changes shape. We have the aqueous humor. It's a fluid that nourishes the internal structures produced from the iris to the lens, but flows up to the cornea to the iris. The sclera we went over. The vitreous humor is a jelly-like fluid that is at the back surface of the lens to the retina. So the medial rectus muscle is the muscle that connects to the side of the eye near the nose. It is an extraocular muscle that moves the eyes inward. The lateral rectus muscle is also an extraocular muscle that attaches to the side of the eye near the temple. It moves the eye outward. The retina is where the photoreceptors are that sense light, also blood vessels that nourish the photoreceptors. The choroid is a layer of tissue between the retina and sclera. It has a large supply of blood vessels that nourish the retina. The macula is a part of the retina that has millions of tiny photoreceptors called cones that make visual images detailed. And the optic nerve is all the nerve fibers from the photoreceptors bundled together that they make up the optic nerve. Next screen. Oh. So the information. So the next is the 3 most common disease processes of the eye. Macular degeneration, cataracts, and glaucoma. Macular degeneration affects central vision. The macula gets damaged and cannot focus central vision. There are 2 types, wet and dry. Wet macular degeneration happens when abnormal blood vessels that are behind the retina begin to grow under the macula. This causes fluid and blood leakage and scarring that affects central vision. The first sign of wet macular degeneration is when straight lines appear wavy. Dry macular degeneration happens when the macula thins due to aging, which slowly blurs central vision. Dry is more common than wet and accounts for 70 to 90% of cases. Dry progresses slower than wet and usually affects both eyes. The first sign of dry macular degeneration is drusen, which are tiny yellow or white deposits under the retina. With age, drusen are normal, but large amounts of them increase the risk of dry or wet macular degeneration. Macular degeneration is the leading cause of permanent deterioration or close-up vision and reading among older adults age 65 and older. Cataracts is when the eye lens becomes clouded. Cataracts are the leading cause of blindness worldwide. Any age can get cataracts because there are many reasons they develop. Most cases are age-related, but causes include diabetes, alcoholism, smoking, family history, previous eye injuries or surgeries, excessive amount of time in the sun, and steroid medications. So any age can be susceptible. The signs of cataracts include blurry vision, difficulty seeing at night, seeing halos around lights, and seeing double. Surgery is the only fix for cataracts. A dilated eye exam will check for cataracts. Glaucoma damages the optic nerve. Glaucoma happens when the normal pressure for fluid in the eye increases slowly. There are two types of glaucoma, open angle and closed angle. Open angle glaucoma is chronic and progresses over time. Open angle is worse because it happens so slowly that by the time the symptoms are noticeable, the disease is in the advanced stages. Closed angle glaucoma happens suddenly and is painful because it happens so quickly. Medical attention is sought out before the damage is permanent. Because it happens so quickly, medical attention is sought out before the damage is permanent. A dilated eye exam will be used to check for glaucoma. Treatment for macular degeneration depends on which type and how far advanced it is. Early macular degeneration can be treated, but there are dietary supplements that can help stop progression. Treatment of cataracts mostly include management of symptoms like brighter lights in the home, anti-glare glasses, and using a magnifying glass when needed. Surgery is the last resort and only recommended when the cataracts affects everyday life. Cataract surgery will replace the lens with an artificial lens. Treatment for glaucoma can include prescription eye drops, laser treatment, and surgery. Surgery will drain fluid from the eye and decrease pressure of the eye. Macular degeneration doesn't have much that nurses can do for the patient, but education on lowering risk, education about regular exercise, smoking cessation, and a healthy diet to help maintain proper blood pressure and cholesterol levels. For patients with cataracts, early on the nurse can advise home treatments and new glasses or contacts. If necessary, the nurse can educate the patient about the surgery. This will only happen when necessary because of daily tasks being affected. And for glaucoma, there really is no treatment, so the nurse can educate the patient on getting regular eye exams and being aware of the symptoms that might develop. And I'm going to add my link here. These are my references, and that was everything about the eye. And my name is Patricia Sanders, Adult Health 1 at Aspen University.